Good day everyone, welcome back to this space. Thank you so much for joining us once again. If you are just joining us for the first time, kindly subscribe to this channel on YouTube and make sure you follow us on Facebook, WhatsApp and TikTok. Today we want to talk about preeclampsia and eclampsia and how these differ from every other hypertensive crisis or diseases that we know, and also how we can prevent our women from developing this during their pregnancy. Please don't forget to share this video to your loved ones so that they can also benefit from what we are doing. Right, so let's quickly look at preeclampsia and eclampsia and compare it with other forms of hypertensive diseases. So the first thing is we want to talk about gestational hypertension. So in this case, we want to look at hypertensive crisis during pregnancy. So the first one is pregnancy-induced hypertension. So in case of pregnancy-induced hypertension, it occurs in a woman who has been normotensive before, meaning that before she becomes pregnant, she doesn't have hypertension. But when she becomes pregnant, she develops this hypertension. And usually, this occurs in the second half of her pregnancy. So we know that pregnancy is expected to be 40 weeks, which is the normal value we give. So second half meaning that as from 21st week of gestation. So after 20th week. So whenever she becomes hypertensive, then we can say she has pregnancy-induced hypertension. But in this case, it will be absence of proteinuria, meaning that when you check her urine, protein is going to be negative. So there will be no proteinuria, just hypertension. So that is pregnancy-induced hypertension. Preeclampsia and eclampsia, they are also gestational hypertension, meaning that they occur during pregnancy in a woman who doesn't have hypertension before. I will be explaining preeclampsia and eclampsia later in detail. So we know that there is gestational hypertension, which we have pregnancy-induced hypertension as number one. Then we have preeclampsia and eclampsia as number two. The next thing we want to talk about is chronic hypertension. So in this chronic hypertension, the woman has been hypertensive even before she becomes pregnant. This is usually when a woman has a blood pressure of over 140 by 90 millimeters of mercury, even before she becomes pregnant, or when she's pregnant and she's having it in the first half of her pregnancy. Meaning that if she has this hypertension before 20th week of gestation, then it is chronic hypertension. So the third category that we'll be looking at is chronic with superimposed preeclampsia. So in this case, this woman had hypertension even before she became pregnant, then with superimposed preeclampsia. But we know that hypertension is just the blood pressure. But presently, now that she's pregnant, at the second half of her gestation, she's having this hypertension plus proteinuria. So then we can say this is chronic hypertension with superimposed preeclampsia. Let's now look at what preeclampsia is and eclampsia and how we arrive at saying yes, this person is having preeclampsia or is having eclampsia. So when we say preeclampsia, the first thing is we need to know that it is a multi-systemic disorder. So meaning that it affects so many systems of the body, so which is characterized by hypertension, proteinuria, and previously edema. But now edema is not a prerequisite for diagnosing preeclampsia. In actual sense, for us to say a woman is having preeclampsia, then the woman needs to have hypertension with significant proteinuria occurring in the second half of her pregnancy. And also this resolve within the first 6 weeks after her delivery. So when this occurs, then we can say categorically that the woman has preeclampsia. Now, what is now the difference between preeclampsia and eclampsia? So in preeclampsia, it is only hypertension and proteinuria that the woman has occurring in second half of her pregnancy and resolve within the first 6 weeks of her delivery. So in case of eclampsia, just like preeclampsia, there will be hypertension, there will be significant proteinuria, and this will be occurring in the second half of her pregnancy, and there will be fits, which is what we call seizure. So there will be seizure in the woman. So whenever a woman has this, then we can say she has eclampsia. In our next video, we'll be talking more about how to categorize the hypertension or how to diagnose it and also how much of protein is significant before we can see a woman is having preeclampsia or eclampsia. So please don't forget to anticipate for this video, and right now kindly subscribe to this channel on YouTube and follow us on Facebook, WhatsApp and TikTok. And please don't forget, share this video to everyone and let us have your feedback in the comment section. Until when next we meet, bye for now.